don't let it overwhelm you. Like, it's not over. You are a nurse already. You already know this is your specialty. So now you just get to show people that you're great. And just don't let the test overwhelm you. You are great. You already are doing something that a lot of nurses aren't doing and going for a cert.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Hey everybody, Kevin McFarland here from the Art of Emergency Nursing, and thanks for listening to the podcast. I appreciate you being here. If you're listening to this podcast in real time, it is about mid-August, and right now almost everybody I know who works in the ER is getting their butts kicked. So if that's the case, I just wanted to let you know that I'm thinking about you. Keep fighting the good fight. Keep doing the best you can for your community. They appreciate you more than they'll ever be able to tell you, and I appreciate you too. I also appreciate you taking the time to listen to this podcast. If you haven't done so already, please do me a favor, leave a rating and review. That's one way that we can help share this show and make sure that other emergency nurses just like you find it. Another way you can help out the show is by just sharing this podcast. Tell your friends, tell your peers about this podcast, and encourage them to listen too. That's how a show like this grows, and I appreciate you guys doing that for me. One of the things I always encourage people to do is I always encourage people to seek certification in their specialty. If you're an ER nurse, you owe it to yourself to become a certified emergency nurse. Jenny, I'm talking to you. And if you are thinking about taking one of those exams, you are going to be absolutely inspired by my next guest. My next guest took not only one, not two, not three, not four, but all 5 BCEN certification exams. She is what the BCEN calls a superstar. And she is officially the 85th member of what I call the High Five Club. Get ready to be inspired, motivated, and fired up in this episode with my friend, Casey.
Hello, I'm Casey. I am happily the 85th nurse to be certified in all 5 BCN certs. Yes. And I also have my CCRN that I did first. So I got all my certs this year in 2021 from March to July. And I work full-time at Hopkins. I work in the PCICU, so Peds Cardiac ICU. I did work in the adult ED, but I moved to that unit for a challenge, which it is. And I also do critical care ground transport with 2 different companies. And I have like 82 other nursing jobs. So I also am adjunct faculty at the community college that I went to. And I also am a volunteer firefighter and paramedic.
Nice. Awesome.
Yeah. Oh, thanks.
So were you a paramedic before you became a nurse?
I did it backwards. So people always ask me that, and they always, when people like, even my college, I became one of the inspiring adjunct faculty this year. And even in the write-up, they had to go back and fix it because they had it listed wrong. I did paramedic after. So I graduated with 4 associate degrees from the community college I went to. So wow. Nursing in 2014, Spanish in 2015, general studies in 2018, just because I wanted to. And I got my paramedic in 2019. And then I got my bachelor's in 2017.
Wow. Holy cow.
Yeah. So I actually did it really backwards. So I actually went to paramedic school while I was working full-time and working nights. So I would literally, and I told them that I wanted to go through the whole program. I didn't want I wanted to be treated like I was in paramedic school. I wanted to do and learn how to be a paramedic. I didn't want to be a nurse that became a paramedic, or, I wanted to like really learn how to be a paramedic. So I went through the whole program, the whole year program, 3 days a week, some days after I got off work. And I did clinicals in the ER, which were painful because I had been it was basically like I was doing free nursing for a year. But then I ended up getting my critical care transport ground job because I did clinicals at the place and they offered me a nursing job there.
Awesome.
Yeah.
Very cool. So why paramedic after getting your nursing?
So my goal is CRNA school, but I wanted to fly, and I knew that a lot of programs wanted you to have your paramedic, or they would like have you take it. And so I wanted it before I even like thought about applying. And I wanted to know the skills and the knowledge. And I was a volunteer EMT already. So I was like, oh, let me just go the next level and I'll just do paramedic school.
Nice. That's kind of cool. I know I have a couple of friends who've done that. They've gone, to paramedic school after nursing school. Some of them have taken like shortened kind of quick programs, and others went all the way through and did the full deal. And neither have regretted it. Both were like, either way worked out pretty well for them. But yeah, it's not super unusual. It's something I always said I was going to do and just never got around to. Like, it was always one of those things I was like, oh, I'm totally going to do it. And I actually even took a couple classes and then just never followed through and never finished because it's just, life gets in the way.
Yeah.
But that's super cool thing to get a chance to do.
Yeah, it was a really good experience. And, it was like, I went to the community college that I went to for nursing school. So it was nice to be back there and like, just even knowing like more people within our little community college. So they had already I was like their little prodigy of the nursing program. So when I went to paramedic school, it like fought like with a weekend, I didn't tell anybody but the program director because I didn't want anybody to know, because I didn't want people to think that I was only a good medic because I was a nurse. And within a weekend, like it showed. So I just let the cat out of the bag.
Yeah, you're like, well, yeah, there's a little something extra you need to know here.
I was like, it's fine.
So at what point, so how long have you been a nurse?
So this is the 6th year.
Okay.
So I'm 6 years in now.
All right. And what made you decide to become a nurse?
So I knew I always wanted to do it. My grandma was a nurse. It skips a generation of my family. So my mom is afraid of blood. She makes her queasy. But my grandma, both grandmas, nurses, the next generation, queasy. And then so I was like, all right, I'm good. But I just kept having like little things that would happen. Like my grandma taught me how to do her insulin shots when I was like 5. And they got me this little medical book when I was like 4. And my mom said that I just carried it around and I would like sit and eat like cheese on the floor and just like flip through this book that was like the size of me. And I always liked it. And it was like like my mom, when I was in high school, she had gastric bypass surgery, and she ended up having a DVT and PEs from it. And when she was in the hospital, like I was all about everything that was happening and super interested in it. And I was like, oh, am I interested in medicine or nursing? And I was like, no, I like caring for people and I like being the person that's there, like taking care of them. And it's so funny, when I moved, my husband and I just moved to our new house, and I found like when I was packing up stuff, I would always be the person that's like, I may use this binder from this class later in life, which never, but I was like, I'll use it. And so I found my binder from chemistry, and one of the projects was like, you have to use a chemical element to write a story. And of course, like in the story, I was an ER nurse. So I was like, well, I guess I was meant to be, but I always wanted to be an ER nurse and like do transport. I never want to do anything else.
That's awesome. So now you said your long-term goal is maybe CRNA?
Yes.
Nice. Very cool.
Hopefully.
All right.
Yeah. So I went to the dark side I've been to the dark side in the ICU once or twice, but I went to the dark side to get the ICU experience like again for another year and then hopefully apply.
Nice.
So
Good for you.
yes, but I love the ER. I feel like that's one place that like my heart is ER, and like transport nursing is, they're equal.
That's cool. That's really cool. Tell me about a patient that changed the way you practice.
So I've had a lot. I work in inner city Baltimore, and I worked at one of the poorest hospitals, like not the hospital poor, but the area around it. And every patient that I had there, I worked there as a new grad, but I started out on a tele floor and I moved to the ER. And I don't know if anybody ever has been to, I'm from Howard County, which is one of the wealthiest parts of the United States, which everybody loves to tell you about, like, oh, it's such a great place. But when I graduated, I never wanted to work there. I wanted to work where I was like with underserved populations. So I didn't even know the name of my hospital when I applied, but I said, I need a job. I'm gonna apply here. And every patient that I saw in that ER, it changed the way that I was a nurse, because it's real, like really seeing people, like having to really fight with people to stay because they have to go to work or they have to pay bills, or somebody's going to pay their rent and they're having a heart attack, and then they want to leave because if they don't pay their bills, and they're like, I think they'd be okay, and they're like, no, if I don't pay it today. Seeing people that are homeless that are just asking you for, like, I think the first thing that really made me realize the population I was in was I had a patient who was very nice and kind. He was a homeless patient, so nice and kind, and he was being discharged, and he asked me he only asked me, he didn't ask me for anything the whole time he was there. He was there for being treated. He was being ops because he was hypothermic, because it was like wintertime. He asked me before he left, if I could find him a coat anywhere, and if he could take a shower. And I don't know why, but it just like made me realize like how much it meant to people, like that you care about them. And when I said yes, he was like, really? And I was like, yeah, nobody else they're gonna clean this room. Like, you can take a shower here. And just seeing people, like the humanity that you get in nursing that's working in an underserved population really has changed how I view the world, but also like in the nursing that I do.
Yeah. Now, did you have jobs before you were an ER nurse, or was an ER nurse?
So I worked in the teleops in my hospital, and I did like little odd jobs like babysitting and stuff before I was a nurse. I was a preschool teacher. So like any weird job that somebody said, and I was a CNA, GNA. So dealing with older people, I had no problem with, but I got lucky. I had started in a new grad, and as a new grad in a tele unit, and I knew I wanted to go to the ER, but there were no job openings. And then my unit closed when I was like 8 months into being a nurse, and I was like, am I gonna get fired? And the ER nurse, the manager in the ER was like, no, come on down to us. And I was like, okay, I'm coming.
You're done.
So, done. I'm there.
Sold.
I'll start tomorrow.
That's awesome. Well, that worked out okay.
Yeah. And I got to do a lot of stuff too. And that, like, when I started, my manager saw potential. So within a year and a half, like I was really trying to read more, and they were like, oh, we want to promote you to charge. And I was like, you sure? Like, it's only been a year and a half. And they said yes. And I kind of just fell into it, and I really liked it. And then I started precepting and doing triage as well.
That's awesome. Very cool. How exciting. What a cool trajectory to end up, kind of have an idea where you want to go. And then like, it just kind of happens to work out so you get there.
Well, it almost didn't happen because my parents were like, not lower income, but it was very clear when I was growing up that it was going to be like, I had to find ways to go to school. So when I graduated from high school, I knew I wanted to be a nurse. I just didn't know. I got accepted into 2 schools, but I was like, I'm not going to go because I can't bankrupt my parents to do this. So my mom was flipping an ad, and she found an ad for a scholarship for nursing at Howard, which is where I went. And we went, and they told me that I had to take placement tests, and I had no clue what they were talking about because my parents my mom went to college and my dad went to a trade school, but she went to a small college in Indiana and my dad went to a trade school. And so they were like, we don't know we don't know the process. Like, we don't know anything.
Yeah.
So they kind of walked us through it. And then from there, we just kind of went. So I was lucky, but I always tell people like, this story's all cool and everything, but I was like, I'm just like a little community college kid that I'm lucky that I was able to get into school.
That's funny. Funny how that works out. Like you're like, I was the first one. I was the first one in my family to go to college. Like none of my family had gone, and so I remember like when I was signing up for the community college, I remember my mom going, "I have no idea how to help you." She's like, "See if you can figure it out." I don't even know. So
yeah,
which it was a community college. I later ended up working at as an EMS instructor, and then got my nursing degree from. So it all worked out, but.
Yeah, it finds a way to work out, I swear.
It finds a way somehow, doesn't it?
Yes.
It's kind of crazy. It's kind of crazy. So what made you decide to go and get all 5 BCEN certifications? Why'd you decide to do that?
So at first, it's funny because I was talking to Pam Bartley and I said, oh, is this a crazy, I want to be like you. And I started like on this idea in 2020. I was like, I'm going to get all 5 and I'm going to get my CCRN. I'm going to get all of them. And then when the pandemic hit, and I was like, okay, well, pause on that. And I was working so much and all of the transport really picked up. So, I mean, I was working all the time. And my husband's a firefighter and paramedic. So we like didn't see each other for like, I think like at one point it would be like we would see each other in passing and we would leave like Post-it notes for each other, kind of like that's how we didn't see each other. And I was like, I'm going to get all 5. And then the pandemic hit and I was like, okay, not going to get all 5. So this year I was like, okay, maybe I'll just, I want to go to CRNA school. What's going to have me, where am I going to stand out? And I'm 6 years and I don't have any certs to show for all this experience and knowledge that I've like built over my career. So I was only planning to get the CTRN and the CEN. I was only planning that. And then people were like, oh, well, if you want to do flight, you have to do CFRN. People look for that and they're very similar, like CFRN and CTRN. I said, okay, well, and then people said, well, I took them the same day. And I was like, that's not me. I'm not that great. So I decided this crazy idea that I was going to take the CTRN and the CFRN in 1 week on a Tuesday and a Thursday. Ooh. And the CTRN was the first test I took. And that has to be, out of all the certifications I have, that was the hardest one.
Really?
Oh, it was so hard. It was like mixing the CEN and the CCRN together, but like notching up the difficulty. And I was like, whoa, this is what's going to start this journey. Ugh, it's going to be a rough one. And then I saw that I passed on the screen and I was like, I didn't believe that I passed. I thought it was like some like thing that they're like, pass the computer that you passed the test or something. So I come out and I'm like talking to the lady. I'm like, so did I pass? And she's like, well, it's supposed to come up on the screen. I said, well, it said pass. And she was like, well, then you passed. I said, well, can I get the printout, lady? And she was like, yeah, you can. Yeah. Well, it didn't print. And then I couldn't get my results. And BCEN, I had to call them because they couldn't figure out why I didn't get the result. And they were like, well, you passed, but like, and I was like, well, I take the CFRN. So I like on Thursday. So I want to see if there's anything that like I clearly like did not do well, because I'll just look at it real quick. And then I took the CFRN. And then after that, I took the rest. And I didn't plan on it. And then as things started to fall into place, I added the CEN and I added the TCRN because I was like, I mean, I've studied for everything now, so why not just try those too? Yeah. So every time that I kept seeing pass, I was like, what? I did? So, and then I decided to take the CPEN. Like, I was like, oh, I'll wait to do that. I'll wait a little bit. So I took EMPC and then I was like, well, all right, I guess I'm going to take it.
Yeah, you're like, let's do it. Come on.
It's fine.
That's awesome. I know a couple people that, they get their CEN and TCRN, and they're like, well, maybe I'll just get one more. And then you're like, well, you got 3. You might as well get the last 2. So.
Right. And I feel like
Right.
I did the two that people don't even like, the only two that people never get. So I was like, I want to be a transport. I'm a transport nurse. I've been doing it
Yeah.
for almost 2 years. So I'm gonna get it now. And
That's
then
awesome.
I just kind of went from there.
That's cool. That's really cool. What an exciting thing to be able to do. So
The mental toughness that was involved.
it takes a lot of mental toughness.
Yeah. And just like I kept telling myself, like, it wasn't even like it was like effortless, like studying, because I got so used to studying like everywhere I went. So like my husband and I like to take little adventures and like drive and go see the world. So we'd go drive, see the world, but on the way I would be doing questions,
Hitting the books.
reading. Yeah, like wherever we went, that's what I
That's
would be
funny.
doing.
That's funny. So in all your test prep and getting ready for all these tests, what was like was there like an overall theme to your learning? Like, okay, I need to, that like is it the challenge of it? Is it just, like what drove you to go ahead and just get them all done?
So I think it was more of like, I've it was really weird because in 2020, when I thought I was going to do them all at the same time, I had this like, and it's funny because I saw the flashcards and I like laugh at myself for how silly it was. But I basically took every test blueprint, right? I read through them and then I put them on one page next to each other. And I was like, okay, this is the stuff from this, and this is where they overlap. And if I study like all of these study guides in one day, then I'll just take them back to back to back. And that was kind of my mindset in 2020, which I think is why, like, and now this year, I was just kind of like, okay, it was very spontaneous. So I would like call my husband and he would be like, oh, you, or he'd see it pop up on our calendar, like, oh, you're taking another cert. Okay. Like, oh, you added another one. Okay. So, and he would just keep saying, like, I think you can get them all. So just keep scheduling them. But it was like, I just kept thinking to myself, like, I I can actually get them all. Like, and I've studied this. I just have to add in this content. And like kind of the theme was like, I like I really love seeing all the people, and I saw a lot of people with like, oh, superstar, and I have 5 certs. And I kept thinking like, I want to get there. And if I don't do it now, I probably won't, or like I'll be mad at myself for not just going ahead and doing all of them. So I was kind of like, I studied for one, so I'm just going to keep studying for all of them. And I kept telling myself, like, this is when I was in nursing school, I would always tell myself before tests, and my husband and my best friend are in the nursing school that I teach at now. And I always tell them, like, it's such a silly thing, but like I saw this quote when I started that was like, dreams are just dreams until they become a reality. So I kept saying that to myself, like, dreams are just dreams until they become a reality. Every time, if I didn't want to study, I would just say it. And the motto for my community college is like, you can get there from here. So I kept saying, like, like my students, I was teaching clinical, and they were like, they started putting in their calendar like when the next test was, because they were like, they would laugh because my email signature would change every week, and they would be like, oh, you passed it. And so every week we would like, they would want to know, we would do like a study session on something that they were learning but was pertinent to like certification. So I would, we talk about trauma, or we talk about something that would interest them, and it helped me study and it got them interested. And I kind of like, I saw all my students getting so excited, and they're not even nurses yet, but they're just so excited about like that. And I was like, oh man, I can't let them down now.
Yeah, now I got to do it. Now I got the pressure.
Yeah, now I have to do it. So, and the worst thing is I didn't tell anybody. The only people who knew when my tests were my family and Pam. So they're like, I didn't like, she was like, oh, well, do your study process while you're studying. And I was like, no, because if I don't pass, like, I'd rather do it in quiet and then share that I passed, rather than take people on the journey and then I don't pass.
Yeah, I remember when I took so I have the CEN and the TCRN. I used to have the CPEN and I let it go. And the only reason I let it go was at the time there was a requirement. I don't think they have it anymore. At the time there was a requirement to have so many hours of working in a PEDS environment, and I just wasn't. So I was like, I'm not gonna lie on there and say that I'm working PEDS when I'm not. So I ended up letting it lapse, which I regret, because it's like, like I probably had pretty close to the CEs I needed. I probably would have had to get some more, but not many more. And I just remember being like, well, I don't know, it's really not a big deal. And I was like, it's all right. And then I'm like going, man, now I'm sitting there going, what was I thinking? So
Yeah, and I felt like, you get them, and a lot of people will just renew by CE and stuff. But I felt like I am like really weird about certification. Like I feel like, you should work in the environment that you're going to be certified in. And the only place that I am not working in is obviously I don't fly. But the only reason that I took it was because it was so similar to CTRN. And some places I was like still thinking like, do I want to fly? And some places still, if they require a cert, it's that, not CTRN.
Yeah.
So I was like, I'm just gonna do it. And I was like, if anybody ever asks me, I'll just like, that's the only place that I don't work in that's not critical. Like that's the only place that I was like, no. But I was like, I have the experience now. And I actually had taken CEN in 2017 and I failed by a point.
Oh,
And oh, it hurt my soul. And it was like, I thought that I was like, everybody had encouraged me to take it. And I was not prepared at all. And it showed. And I thought that I was like, I don't know. I thought that like, you're an ER nurse and then you kind of forget that like in Maryland, we don't see pit vipers, but other places do.
yep.
And, and we're at that point, I hadn't been in a mixed ER. It was like an adult ER that we saw kids, but I hadn't worked in a peds ED that you see, even if it's an adult, you see a lot of kids still. And so I was like not prepared for children on the exam. I was like,
Yeah.
well, I'm not taking CPEN. I'm taking CEN. There's no, this is adults. And so I was like not prepared. So it kind of rocked me for a little bit, but then I was like, like now's the time. Like I'm not the same nurse that I was like when I was 2 years into nursing. Like I know way more now than I did then.
Yeah, for sure. For sure. Yeah, I think that's one of the things that kind of throws people off is they'll take the CEN, they'll be like, well, there's PEDS questions on there. I'm like, yeah, there probably is. Probably is a couple PEDS questions or questions that may just happen to be PEDS. I mean, it may be just an airway question that just happens to be 6 years old.
Yeah.
But the principle is exactly the same. So
Yeah.
that makes it a little bit different, but it's not, it's not like huge like it, but so, I mean, there certainly was some parts of the PEDS in the CEN, but it's not a big part, but you got to be ready for it.
Oh yeah. And that test is I mean, I feel like it's a lot of underestimation about how difficult that exam is. Like for it being the like flagship of like the BCEN, because the most people have that, it's very hard.
Yeah.
And that's probably the CTRN was the hardest. And I tell people, they're like, oh, but you took the CCRN. I'm like, yeah, it was still as hard. It was harder. And
Yeah.
the CEN is the second hardest that I took.
Yeah.
So hard.
Yeah. I started studying for the CTRN or CTRN. I started studying for that, did a reviewed, some of Pan's material. And I was like, okay, I'm gonna go take this test. And then, life happens, of course. And even with all the certifications I had, the one I didn't have was one my boss wanted me to have. So my boss was like, yeah, you have to, our organization mandates that you're certified in your specialty. So they're like, and they're not, they don't joke around about it. They let people go based on them not having their certification. So I was like, okay, I better start focusing on the NPD, the Nursing Professional Development Certificate. I'm like, I'm going to focus on that first. So I did. I focused on that and got that done. But it was one of those where I was like, I don't want to. I was like, maybe I'll hold off taking the CTRN for right now. But I kind of regret it now. I kind of wish I would have just done it because then it would have been done. So
yeah. Well, the nice thing I always tell people is like the most beautiful thing is that these things are always around. Like they're always there. They've gotten. I mean, I took the TCRN after they changed the blueprint, and I felt like out of all of them, it was like the most straightforward out of everything. And
yeah.
I felt like I was like, oh, this is like a vacation taking this TCRN. I feel like I actually passed. And I was like, wait, no, I don't want to think that because I'm not at the end yet.
Yeah. Don't be that guy. Don't be that girl.
No.
That's funny. What study tips do you recommend to people who want to get their certification?
So obviously I'm going to say Pam Bartley's study material is like that's it. That's what I use. If anybody's studying for your certs, that's all. But what I did is what I think the big pitfall of people, because I've had coworkers who use her material that didn't pass, and other friends or other like colleagues that have asked me like, oh, I used her material, but I didn't pass. And it's still, my big tip is like, you still have to do your own studying. Like her guide is a guide and she takes everything and makes it all small into one study guide. But there were things like tracheobronchial injury.
Yeah.
When I first read that, I said, I don't know what that is. So I went and grabbed, and if you don't have, like, I have a bookshelf of books from, classes, because I always was taking classes because I wanted to know, what was going on in the specialty. So I have a bunch of books, but if you don't have them, look them up and look things up and add them to her study guide so you know what it is. And I wanted to know more than just like, oh, it's a clothesline injury. Oh, Hammond's crunch. I want to know more than that. Like, why do they have Hammond's crunch? Why are they hoarse? So I would say definitely like know more. I mean, the questions are not going to be like, not to scare anybody, just take the certs. It's really, they're not that bad, but they're not like, oh, what is this versus this? It's like, oh, this disease process. Now let's take it up a notch. So
a
I
lot of
definitely think,
a lot of application, a lot of higher level kind of stuff.
yes.
And those tests are no joke. I tell people that all the time. Those tests are no joke.
Yeah. And I think people, like they didn't realize, I guess, until last year, because I saw it posted a lot about the pass rates of all the BCEN exams, how like TCRN is the only one that's above, I mean, really above a 60. All the rest of them are like right at the 55 mark. And it's because there's people just think that, like, I think that we in emergency sometimes are like, we're emergency nurses, we know everything. And we get locked into like what our system does and not like what the world, or like what the whole US is doing.
You're absolutely right. I think one of the things I tell nurses all the time, and I've seen really experienced nurses not pass that test. And one of the things I say is as ER nurses, we're like, we can just wing it. Like, we'll figure it out. And that's not the kind of test you can wing. It's just not that kind of test. You can't just go in there and be like, we'll wing it. It'll be okay.
Yeah.
You're
and
like,
I think,
no.
And the first time I took it, it was essentially, and I also didn't know that when you paid for it, you had to like schedule it. Like, so the only time that was open in that when it was like still like when you had your 60 days, the only time that was open was 2 weeks after I paid. I was like, what have I done? So
like, well, crap, here we go.
I was like, well, 2 weeks to learn all of ER nursing. Okay, that sounds great.
When I retook my CEN, I had my window, and I was like, okay, I picked a day, got the day set, and then like a couple of days later, my wife's like, hey, I want to go out of town on this day, and I was like, crap. So I was like, well, I better finish, just get studying. But and it was one of those where I was like, right around the corner, and I was like, I got to study. The same thing happened when I took the first exam. When I took the first exam, I paid my money. I was taking a 2-day review. So I did a 2-day review, and I was like, okay, I'm going to take it on that Monday, right? I'm going to go just get it done. So I was all excited about that. And then, life happens. I get busy, get distracted. And finally one day, like months later, I was like, I forgot about the test. I forgot I paid for that. I wonder when my window closes, because you get your window of time that you can do it. So I look it up, and like my window closed on like Tuesday, and it's just like Friday. So I was like, okay, we're going to be like, okay, we're going to be busy. We're going to have to get this done. So I told my wife, and I was like, well, here's what's happening. Now, of course, my wife ends up going into the hospital that same weekend. And I was like, oh man, I'm screwed. I'm dead in the water now. And she's like, no, just go. She goes, go study, like, just get it done. So that's what I ended up doing. Ended up doing it and got it done. So I was like, no, all right, here we go. Boom, done. So that's
right now. Yeah, my husband's in nursing school, so he's like, he's in this fast-paced course, and I'm trying to help him study. And so I even told him like a week, 2 weeks out from the CPE, and I was like, honey, I love you, but we're gonna have to focus on me for a sec, because I gotta study, because my exam's coming up. And after that, my undivided attention will be with you. Yeah. But like, I just want to pass, because if I don't, I'll be sad.
Yeah. Yep, for sure. Now, did you use anything besides Pam's study guides and Pam's material?
So I used like, the common ENA books. Like I used TNCC, and I looked stuff up in EMPC a lot in those 2 textbooks. And then for the transport exams, I got the ASTNA model
Yep.
I got their core curriculum book, it's like this guy. That's over there. But I got that, and I was like looking over that. And I took the IA Med class, the flight medical provider, because I felt like that was like a good review because I don't fly.
Yeah.
So in the beginning, I was like, gas loss who? And so by the end, I felt like more confident on it, way more confident. But in the beginning, there was like struggle busing with it.
Oh.
Yeah, I find that I have to keep myself accountable. So like I make this is my little my little cert goals.
Nice.
So I literally like put it on my desk, and then I put in progress, and then keep myself like every time I sit down, I like look at it like, am I moving towards the things that I want?
Good for you.
So,
and what is the long-term goal?
So long term is hopefully a CRNA. I have a backup is nursing education. I really like teaching people. And I like teaching all my students. So long-term goal is CRNA. If I had my way in life, it would be CRNA and teaching. So I really like both. I really like teaching a lot. It's so rewarding, and more so than I thought. Like I really just want to give back to the school that I went to. And I've really been able to get involved with some really great things at the college that I work at. So it's definitely become much more of like a goal, and just mentoring people,
That's awesome.
and giving. And I mean, I got like where I was with a lot of help. So I just, a lot of my students, I help them with their essays or scholarships, because people don't know, like the college I go to gives out so much money, and people don't know they exist, or they don't know how to write an essay, or they don't know how to do that stuff. And I didn't know, and I just kind of fumbled my way through it, and I don't want other people to do that.
Yeah, I agree 100%.
So, yeah.
What's the best advice a nurse mentor gave you?
My first nurse manager kind of took me under her wing, and she helped me get into leadership at the hospital. And she always said to me that whenever somebody tries to close a door, just keep pushing it open. So it doesn't matter what kind of force somebody has at a door. Absolutely. Find a way. So get creative. And she's always like jokes about the glass ceiling, and she's like, if nothing else, like go for the ceiling. And so I've always thought to myself, like, if an opportunity like tries to close, like, is there another way that I can like get around that obstacle? So that's probably the best, and always like she literally was always so strong about like, don't give up. Like other people might think that your ideas are silly until you do it, and then people like love the idea. Yep. So
Yep, absolutely. Yeah, everyone's like, oh no, nobody can do that. And then you're like, oh, you just did, huh? All right. So that's cool. That's really cool. What advice would you give somebody studying for the exams, studying for the different certification exams?
I would say, don't feel like you have to like, you're listening to me talk about how I did all these things in like 4 or 5 months. Like, don't feel like that. And whatever your timeline is, like be realistic when you study. That's probably the best goal. The best tip I can give somebody is be realistic, because if you're like, think that you're going to study, we all work full-time jobs. If you're working full-time, study for an hour or 2, 3 times a week. Yeah. And then if you are somebody that you like to do questions and you have to do questions, if you decide that you're going to pay for questions, do those on a Saturday, but like take whatever study material you choose to use, split it up, and don't let it overwhelm you. Like it's not over, you are a nurse already. You already know this is your specialty. So now you just get to show people that you're great. And just don't let the test overwhelm you. You are great. You already are doing something that a lot of nurses aren't doing, and going for a cert.
Absolutely. I remember when I was a brand new nurse and I showed up. I think I took my CEN when I'd been a nurse for about maybe 6 months. Like I was fairly new, and I was like, I'm going to go take the test. I was already working as an EMT. I worked as an EMT and EMT instructor. So I was like, I know this material pretty well. I'm a pretty good studier. That's what I'm going to do. So sure enough, I go take the test. I show up the next day and I'm like, oh, yeah, I'm a big deal. I'm pretty awesome. And this one nurse goes, that test doesn't mean anything anyway. And I'm like, screw you. It doesn't mean anything. I was like, it doesn't mean anything to you. So I was like, nah, I don't think the rest of the world feels that way. So
Yeah. And I find that people that say that, it's like they either are really confident in their skills, and there's nothing wrong with it. Like I was super like, oh, I'm a really good nurse. And,
yep,
my patients feel that way. So do my coworkers, like they feel this. And I was still like, but certification, I mean, it's different. It puts you into a different league almost, because your certs speak for you before you even say anything. So, if
absolutely.
somebody sees your email and you have your certs at the bottom, they know that you already have that expertise going into it. And yes, people it can say it's just a test, but I feel like whenever I see people that are like, oh, it's just a test, they've either been unsuccessful or they haven't taken it.
Yep,
So not like they're terrible people or anything, but I find that sometimes in nursing, when there's negativity, it's because people haven't put themselves out like you have, and be afraid and not be afraid to fail. Because if you're afraid to fail, you're not going to do it.
absolutely. And there's always haters, right? There's always haters who are going to be like, they're going to be like, whatever. Doesn't mean you're cool. It doesn't mean you're, this or that. And you're like, I think it kind of does. So
Yeah. And I think too, when you have the certs and you can speak on it, and it's not just like you took the test. Like when I studied, I wanted to know the information, because I knew what was going to come with having 5 certs and having CCRN. It
me
means that when
too.
you start speaking to people, they expect that you're going to know what you're talking about.
Yep.
And so I don't take that part lightly, but I also wanted to be prepared that if somebody was going to speak to me or ask me about pathophys, or even try to challenge me because they feel like that's what they want to do, that I would be able to speak to the experience that I showed that I have with certification.
Absolutely. Absolutely. Yeah. It's one thing to talk about it. It's another thing to do it. Like, and
Yeah,
you got to be able to hold your own. So
right.
yeah, for sure. For sure. So that's super awesome. How exciting. One of the last questions I always ask my guests is a question called 3 things.
Okay.
And it's, what are 3 things an emergency nurse should always remember? And what are 3 things they can just go ahead and forget?
Okay. 3 things to remember. So I would say the first thing to remember is always kind of like, I guess it's a thing to remember as an ER nurse. We always go, 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 go. And sometimes you have to stop and see the big picture because you might miss something. I've learned that a lot in my career. That sometimes things that appear as one thing when you're going 80 miles per hour, you're missing something smaller. And I've missed people, like my triage nurse has missed that somebody was a new diabetes patient in DKA with Kussmaul's respirations, thinking that they were just having an anxiety attack,
Yep.
because they were trying to triage a million people a minute, and they're like, oh, they're just anxiety. And when you come in and you stop and give your time to the patient, and that's that. Another thing I think that every single nurse should remember is like, no matter how burnout you are, no matter how much you've worked extra hours, and the pandemic like hit all of us and hurt our souls, is like, don't lose your compassion in ER. We can be really mean people to each other, but also to patients. You see the person come in for 80,000 of the same thing, and you're like, oh, this is just Jim Bob again. And then you either miss something, or that's the time that they really need you, and you're not giving all your compassion. And it's so hard sometimes. Like I'm not gonna pretend like it's super easy. Like,
Oh
but
yeah.
I would
Sometimes it's
say,
really hard.
if you're super mad at somebody, strangle them with kindness.
Yep.
Just strangle them with kindness, because then at least, like, if you're just trying your best to be nice, sometimes people see that and they like feel it, and they at least feel that you're attempting. And
Yeah.
then the
No, I agree.
third thing, I would say it's more of just a medication thing. It's like, always remember what's in your, like, we're all ER nurses. Like, remember your basic stuff, like your RSI meds, where what things, like, we prep everything. So remember the things that become like your right hand, almost like your ACLS algorithms and your RSI meds, and you're setting up people for intubation and stuff. Like, read
Yeah.
up on stuff when you're not at work. And that's like one thing that I think that even when I've had like new grads, like, they always can do. And then I would say, this is just a funny thing. One thing you can forget is how to mix and I'm sure a lot of people have, mixing NPH and regular insulin. Because I don't even know that ER nurses are probably like, we don't even do that anyway, sis. And then I completely forgot about that when my husband is like, I don't know what to do. And I was like, I remembered some stupid mnemonic, and I was like, that's all I got. The rest of it's out of my head. Yeah, they still test them on that. Why?
One of the things I found funny is as a nursing faculty, you probably noticed this as a nursing faculty too. Like, unless you work med surg, there's a lot about med surg you either don't know or don't remember. And all the time, students are asking me questions. And I'm like going, that's a really good question. I don't know the answer to. It's like, I'm gonna have to look that up. I honestly don't know.
Yeah, I literally think that I only know it. I only remember these things because I worked on med surg, but like even I like med surg nurses, we might make fun of them sometimes, and they make fun of us, and everybody makes fun of us, but I think that they literally like they have their 6 people, and I could never go back to that.
Right. Yeah. Like, I gained a whole new respect for them when I was working as a house supervisor for a while. And I was like, these guys are salty dogs, man. They know what's up. They're good at what they do, and they take good care of the patients. And you're like, that's, there's a lot to be said for that. So
yeah, they do.
They could be ER nurses. They just chose not to.
Yes. And some of them come down to the ER and they're like, nope.
Yep. One of my favorite nurses, I think I've told this story on the podcast before. One of my favorite nurses is now a CRNA, and he was an ICU nurse for a long time. ICU nurse, flight nurse, EMS instructor, brilliant guy. And he absolutely hated the ER. Like, he was like, I guess I can't handle this. This is like too much chaos. You never know what's coming through the window. You never know what's coming through the door. You're like, no. He's like, I don't like this at all. And I was like going, how could you not love this? This is like the best thing ever.
It's like the best chaos ever.
Yep.
The best.
Absolutely. I'm sorry, I cut you off for your third. What was your third thing to forget?
You know what? I'm also going to go with humor here. Look here, ER nurses, forget about the jogger scrubs. Give them up. Okay. We step in too much pee and too much blood on shifts for y'all to be trying to look cute in those joggers. Give it up. Those are made for people who work in doctor's offices and people that are pretty, and not the ferns who are out there in the trenches. Just give up the jogger scrub.
Oh man. I think my very first pair of scrubs were like that. They had like cuffed ends, and I was like going, is this what they wear? Like, oh my God. And I'm like, I was like, what is this? Like, I don't wear my pants like this. What is this?
When I was in nursing school, we had zip up tops, and they were like, you have to make sure that they're not skin fitting. They have to be loose. And somehow, some way they conned me into getting a 4X. So literally, and I'll never forget, I got to get, the school paid for me to get another pair because I was doing bed baths as a baby nurse. Like, and when I was in nursing school, and I had my little basin and I was carrying it to the room, and then all of a sudden I was like, what? Why do I feel so warm? And I realized my entire scrub top was in the basin the whole way. And so my entire scrub top, like all the way around, it was just, and then it got heavy because it was huge. And then after that, they finally let me get a smaller scrub top.
They're like, we're going to get you something that fits.
Yeah, I've spilled those little things. I'm clumsy. So I've spilled those things on my entire, like, walking into the room, I just trip. So yeah.
I'm with you for sure. So.
And then I'd like to give a shameless plug to my new little project. It's called Critical Care Casey. It's like in the works, but basically I'm just trying to help my nursing students get through nursing school, and then working with Pam to help get people certified, and just like teaching people things that nobody ever taught me that I had to learn myself. So and trying to mentor people through whatever certification, because I've read that whole list of all the certs that you can get in nursing. So, and just giving people like advice and tips about certification. Like if some people don't have somebody that has like a bunch of certs in their hospital, or they might think it's negative. So I'm here if you want a friend that's here for your certification. Like I'm here. I will give you the tips. I will pump you up. Like, I'm here for you to succeed.
That's awesome. So are you going to do this like on social media? Or are you going to do like, are you going to like get a website and do like, are you going to like do some like formal teaching, or what's the plan?
So the plan is right now to just I'd like to do like group stuff on like Zoom and stuff and meet with people and talk about like their goals in nursing, and like for student nurses, kind of like how I got to where I was, because it wasn't easy to get into anything. And if somebody would have been there to like tell me, it probably would have saved me a lot of like years to get where I want to be now.
Yeah.
It's been a fun journey, but it's been a journey. And I'm kind of hoping it's definitely social media related, because that can be like quick because I still work and everything else, but like a glimpse into like what I'm doing and like how do you get to what do you want to do, and like how can I help you get there. I do that for a lot of my nursing students and meet with them outside of like my clinical time and help them with their essays for scholarships. So I'm not saying that I'm like the great best anything, but I definitely am like, okay, I want to help people with their journey, because so many people like helped me with mine, and I just want other people to like be able to do the same things and not feel like they have to jump through hoops or climb mountains.
That's super cool. I love that. I love that, the idea of giving back and kind of investing into the next group of nurses that are coming up. I think there's a lot to be said for that, because I think a lot of experienced nurses don't do that the way I would want them to.
So, you got to start them off early, but yes.
That's right.
I've enjoyed the time.
Keep in touch. Let me know how things are going, and let me know how things are going with Critical Care Casey. Can't wait to see what you do.
Yeah, so far I'm on Facebook and Instagram only. I'm still working on it and like content for it.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.